Well, I really enjoy the opportunity to follow Dr. Kane's presentation because I would just say I second the motion on every comment and observation. From what we see in our work around the world related to the extension of longevity or the aging population. It's really, I came to this topic about 2 years ago and I was struck very quickly by how profound these simple change in the numbers and the statistics related to aging really are going to be in terms of reshaping the relationship between people and amongst families in every culture in the world over time, and is very well the relationship between people and the public sector that they live in. There is a new normal that is already presenting itself for which public systems and public policy, in fact, the norms and practices of cultures are not prepared for. There will be, in the very near future, in China alone, as many seniors, retired individuals, as there are people in the United States. And in a very short time, there will be as many 100-year-olds in the world as there are people in the United States. And so this is a huge change in the environment. And I'll look at it and say, let me take it from a business, from a commercial perspective. This is a huge change in the population of people who are the marketplace and who are the employee population for companies. And so I won't talk too much about the commercial side, but I'll say that why a company like mine and most companies should be really learning and understanding and focusing on the change in the longevity dividend, the change in the demographics, is that this is a new marketplace. 20, 30 years ago, the retired individual did not represent a cumulative, overall interesting market economically to target products for or to sell to. Today, already, we see many examples of industries, travel, finance, who have strongly caught on to the reality that this new retired, independent, healthy, active aging population is a new marketplace, a sizable consumer marketplace. This will continue to grow, particularly in mature market populations. Also, from an employment perspective, employees. If you look inside the multinational company employee populations, you have the same demographic change occurring as well, and so it has significant implications on how you do employment planning, how you do leadership development, even country strategies, as well as the benefits strategies relative to employees. And there are now, there are also related to your employment population, there are now also changes happening in public policy related to your senior employees and retirement. Innovations such as we recently over the last year was in Singapore, where there's new laws and regulations relative to the enrollment of retirement. So where there's an employment model post-retirement, and I personally think it's quite an interesting and positive approach to deal with expectation of retirement that an employee has, and putting in place an innovation or renegotiation of the relationship between the employee and the company to create permission and an acceptance to being able to continue to work in a role that's different than the role that you were in the core or initial phase of your career. So there's a lot of commercial reasons, employment reasons, multinational corporate reasons that the aging phenomenon matters and why companies like ours look at this and think about it. I want to turn to more than directly the implications related to the delivery of service. Secondly, I was struck as I began. I took the first year of my responsibility for our aging initiative to spend a lot of time attending dialogues and events and meetings and meeting many you folks today to try to listen and learn, as well as very large gatherings of local administrators and mayors and care coordinators in many countries, just to listen and learn. And I was struck by hearing, and I think Dr. King called it a paradox, but I was struck by a trap that innovators are not in intellectually, but by and large the mainstream of the public sector, I think, is in. It's a trap of looking at everything as a cost, looking at the delivery of support for the senior population as a financial transfer payment. And how do we, it could be from the health system, it could be related to pension benefits, but this thinking of the topic as a benefit flow, as a financial payment, leaves one fundamentally only capable of thinking about cost reduction and not thinking about the needs of the services that this money is meant to be paying for. What the forward thinking with the new normal model, I think, needs to be much more about is thinking about the care flow, standing from the individual, from the senior's perspective, and thinking about the constellation of care and support that the senior has for a healthy, active, and independent life for as long as possible, as well as then the support as their vulnerabilities and needs grow. The participants in a care flow are the family members, children, and spouse, the social workers or welfare workers, members in the community, friends that are nearby, as well as, of course, the physicians and nurses that are involved in medical care. And so we see many experiments around the world in innovative locations for taking from the point of view of the individual, of the senior, an approach of connecting up across the silos of medical, social, welfare, and also community-delivered services to find ways to innovate, to bring together and to deliver to the individual support through services and to facilitate and enable the people who are involved in their total care circle. And this helps folks stay more social, be less lonely, not take the loneliness gateway drug to the hospital, be more connected to their friends, be more cognitively active, having activities of their daily life, such as getting food or shopping or having their house cleaned, be much easier to deal with, feeling safer in their own environment, and not feeling the need to go to somewhere to be taken care of, as well as having, when the need arises, the ability to get some medical care or medical advice, or to have a friend or their IE or their maid recognize that this person needs some medical assistance, and if everyone involved in the whole environment knowing who to contact to get some help. This notion of care flow instead of money flow or benefit flow is instead of fundamentally around cost reduction or financial transfer, it's about services and the collection of services and support that the senior needs and wants. So it's fundamentally from a user-centered or a senior needs expectations perspective. Now, what are the services? What are the needs? And you need to have some understanding of what the wants and needs and priorities of the senior are. And this is why I'm very happy to be supporting the EASYCare project, and I think that the methodology of developing some tools and system to more broadly accelerate the ability to get the voice on the wants and the needs of the senior brought directly into the planning of their individual services and the interaction of their individual care circle, as well as being used from an institutional perspective and a public sector perspective on what the population strategy should be in terms of providing services to seniors. So it's, I'm happy to see that step being taken to move from an R&D phase to a scale-out phase, and look forward to finding ways to help accelerate the deployment. Because it's with a feedback capability and assessment capability such as EASYCare that the care flow can be more efficiently and effectively planned at a city level or within the family that's working to support their seniors. Thank you.
Thank you very much, Dave.